Hello, everyone. Welcome to yet another episode of Soulfully Yours. The topic for today is the buzzword these days, that is trauma. And especially, this has come to surface during the pandemic, wherein people have reflected upon their lives. And from the circle of mental health experts, into uh, it has become the word of the common man as well. So we have a very special guest, Dr. Omar Reda, who is a psychiatrist and a Harvard trained trauma expert. Today we are going to learn all about trauma, what is it, what is it not, and for that we have invited Dr. Omar. Dr. Omar, how are you doing?
Hi, thank you for having me.
It's my pleasure. I know you were traveling. Thank you for being here, giving us time.
Yeah, thank you.
So, Dr. Omar, tell our audience what for a common person, what is trauma?
Yeah, there are many definitions of trauma. The most common one, trauma comes from the word wound. So if somebody is wounded, usually we say they are traumatized. Usually, if their wound is physical or visible, we can see it, they are bleeding. We rush them to the emergency room, we take care of them. Unfortunately, many of us, we have invisible wounds. So even though we are
Mm-hmm.
bleeding inside, many times we dismiss our emotional needs. Sometimes we say this is just, you having weak personality or you don't have enough faith. So many people, they struggle with their trauma in silence, and that will just add to the impact of trauma that can go from one generation into another.
Mm-hmm. Mm-hmm. Yeah, and because the people suffer in silence, how can they identify that they are having this issue in their life?
Yeah, that's a wonderful question. Many times, family members, they struggle with their loved ones. Very clearly, they have something, and but they are not open to talk about it, maybe because of the cultural taboo or stigma. So it's very important, first and foremost, to educate people. So education is important. So most of us are going through normal reaction to abnormal situation. So the pandemic, the war, the trauma that happens, especially when children are subjected to trauma by adults, very confusing to the psyche. So unless we tell them that what they go through is normal reactions, sometimes they feel changes in their body, sometimes they feel changes in their mind, their heart, and their soul. So these four aspects are very, very important. So first thing is education, but second thing, which might be more important, is human connection. So we need to make sure that we are surrounded by people who care about us, and then we listen to their feedback. If we are exhibiting changes in our behavior or our attitude, our personality, our beliefs, then our loved ones will give us feedback, and hopefully we can be open to receive that feedback.
Mm-hmm. You mentioned about it carries through generations. So, is it something that is in the genes?
Yeah, it's a wonderful question because many people, they believe that most mental illness, they can, present genetically. It is something that we inherit from our parents. That's not always the case. There are people who are traumatized without having family history. There are people who have heavy family history, but they don't go through too many traumatic responses to the event that happens to them. So it's very important to remember that it's not only the event or the experience, it's our perception, the meaning that we make out of that experience. And sometimes, if we go through trauma alone, it can be really very alienating experience. It can be deeply exhausting, especially if there is a child that goes through maybe physical or sexual trauma. It will affect their core beliefs. They might start to second guess who they are, their self worth, their value, their beauty, their full potential, what they can contribute to their world.
Mm-hmm. Mm-hmm. Having said so, what is then what identifies while certain people, they react differently to trauma. You said it's perception. So how can we be strong in the face of trauma if it affects differently to different people?
Yeah, I mean, people react to trauma on a spectrum, and we don't really judge them by being weak, or we don't necessarily say this person is having, a healthy reaction. As long as they are showing safe response to the event, that's okay. Some of us we get angry, some of us we shut down, others we lash out. Some people might withdraw from their loved ones, others will lean more on their support system. So as long as people are showing their response to trauma in a safe and healthy way, there are many factors that can contribute to that. So some children we notice maybe they went through severely traumatic experience, but there was a caregiver, there was an adult caregiver who showed them love and affection and start to challenge their cognitive, beliefs that they are not good enough. Trauma happens because they are bad people. So many times we, internalize the trauma that happens to us, and we start to make meaning. So meaning making is very, very important in the recovery from trauma.
So is the process reversible? Is it can be, the meanings can the meanings be changed
Yeah, the
over
good
time,
news.
or?
Yeah, the good news it is. I mean, I have worked with trauma survivors for decades now, and I have been trauma survivor myself. I mean, I have written books about this topic. Like one book is about how to break the cycle of trauma. I call that Untangled, because many of us are tangled in a web of trauma that can be quite dysfunctional, can affect us as individuals, but can also break us as families or communities. And another book that I'm currently writing is called The Wounded Healer, because many of us, even though we are caregivers, you don't have to be like healthcare caregiver. You can be any person who is taking care of others on the front lines. Maybe you are a teacher, a parent, a community leader, religious leader, maybe a first responder. So I have noticed many of us, we have deep wounds. Many of us, we actually walking wounded. Some of us are actively bleeding. So unless we pause and take care of our needs, sometimes we will do others disservice, because I want to take care of everybody. I don't want to show any weakness, but people are leaning on me for support. So unless I take care of my needs, I cannot really, in a coherent way and in a way that's a beautiful, take care of other people's needs. So yes, I agree with you. I mean, trauma can show in different ways, and some people will say why this person is showing a reaction that's exaggerated to quote unquote small trauma, and others may be going through big trauma and not showing the same response. There are many factors, internal and external, that can explain that phenomenon.
So you mentioned about your book, The Wounded Healer, and the concept that, if you're not healed yourself, you cannot heal others. So if you're actively walking around, you are actually uh, doing disservice if you are not healed yourself. So can you talk more about your book? What is it about, The Wounded
Yeah.
Healer?
So the reason I wrote the book, because it's very, very deep and personal. Uh, for me, seeing my colleagues and coworkers and sometimes family members and friends go through what we call toxic stress, burnout. They're completely unable to function. They're repeating dysfunctional cycles. Maybe there is domestic violence. Maybe they are taking their anger on their loved ones. Maybe some people are using substance. Others maybe are engaging in self-harm. Unfortunately, I lost colleagues to suicide. So that's why I decided to write about the needs of the caregivers. But not only that caregiving will give us pain, it can actually be a very joyful experience. So the book is divided into four chapters. And the first chapter is about the pain and joy we receive from caring for others. So in my example, I am a psychiatrist. So I work with patients and I work with their families. So sometimes these experiences can be delightful, other times they can be very painful or difficult. And then the second chapter talks about the impact of our trauma on our loved ones. So sometimes I take my trauma from work to home or vice versa. Chapter number 3 talks about the trauma that can come from working within systems. So there are some systems that give us lots of pain, can be dysfunctional or toxic environments that we work on, and other systems that we can change or dismantle or actually can maybe rehabilitate. They can bring us lots of joy. And the last one, which I really care about, is how to sit with yourself and find out the beauty within you, and why we have difficult times sitting in silence and talking about our own needs. Many times we dismiss our needs and we neglect them, and that can really backfire. It can be a cause of dysfunction that can affect not only us, but our patients, our loved ones, and our communities.
Dr. Rida, in a culture where being a giver or being is an act of selflessness, how do you tell your patients to look after themselves first?
Yeah, absolutely. I mean, as we said, I mean, self care is not a luxury, it's a responsibility. So it's not a selfish thing, it's actually quite selfless because it's exactly like you are driving a car. If you don't stop and fill your gas, your car tank will be empty, and eventually the car has to stop. We are not machines. If I ask you, Humaira, that you are going to surgery and your surgeon have not slept in 72 hours, or you are taking an airplane flight and the pilot has not slept, you most likely gonna you know cancel your flight or cancel your surgery. We really are you know trying to put lots of loads on our plate. We have many people that we are the glue that holds our communities together, our families together, our systems together. So many of us, we say, I cannot really afford to take a break because there are thousands of people standing on my shoulder. And that's exactly why we need to take a break. Because if I fall down, the whole system will crumble and thousands of people will fall with me. So there is nothing wrong about, recognizing that we need a break, requesting a break, resting during our break, and then realizing our priorities so we can re-engage, refreshed and recentered, and we can actually do more to our clients and our loved ones.
Very well said. Dr. Reda, in a culture where mental health is a taboo and everybody do not want to associate themselves that they have some problem, and then these trauma triggers happen, they do not identify, the people around them do not identify. In fact, everybody spills their trauma onto one another, and that's how a judgmental society comes into being. So in that case, wherein there are the issues that are beneath the carpet, what do you suggest in these situations, where how can people be more aware and educated about it?
Yeah, I mean, remember, trauma itself is not a mental illness. I mean, there is something called post-traumatic stress disorder, PTSD, and this means, you were traumatized. Now, after trauma, usually within 6 months, you might start to develop symptoms. Some of these symptoms, maybe you relive the experience through nightmares or flashbacks. You try to avoid any reminders of the trauma. Your body might remember some of the traumatic triggers, so you might start to sweat or hyperventilate, or maybe your hands start to feel shaky because your body is, causing you to release hormones that are very important for the fight or flight, like adrenaline, cortisol. These hormones are very wonderful in the short term, they actually life saving. But if you are releasing these hormones because of chronic or protracted trauma, or maybe actually you are perceiving trauma that's not there, and then your body might start to struggle. You have high blood pressure, you might start to have a gastric ulcer, your immune system will decline. So right now we actually challenging that diagnosis as a mental illness. We call it a moral disorder rather than a mental disorder. And some people will call it moral distress. It's not even a disorder because it affects our soul. Like if I am somebody who care deeply about people stories, maybe I start to have what we call vicarious trauma. I listen to other people and I get traumatized listening to stories of others. The more gentle you are, the more compassionate you are, the more prone you are to what we call compassion fatigue and burnout. So we see it actually as a badge of honor. If you, it just means that you are a compassionate person. You have compassion fatigue because you care about others. So we need to, take people away from the labels, from the diagnoses, from this symptomatology, and just try to sit down and explain. There is something recently changing even in the field of psychiatry. We have something called the borderline personality disorder, which is nothing other than severe adaptation to trauma. So people are exhibiting personality traits in response to trauma. So maybe they are having self doubt, they don't have a very good self esteem, maybe they're engaging in self harm because people who abuse them, they gave them very nasty names, they talked bad about their bodies. Maybe some of their abusers told them they actually enjoyed their own trauma. They are the reason that they are traumatized. So when we sit down with them and we give them permission to take the podium and rewrite their own narrative and try to make meaning out of their trauma, healing will follow. Healing is always possible.
Dr. Reda, what happens is, as you mentioned about trauma in childhood, uh, many people do not remember have the childhood memories. So in that case, how can healing happen when there are triggers, there are cognitive triggers, there are emotional or physical triggers as well, but they do not have the memory of the past. How can they be healed?
Yeah, that's a beautiful question. And there is a big debate in the field. There's something called repressed memories. Do we have to actually go and revisit these painful memories? And what's very important here, Humaira, to remember is not to go and fish for the traumatic and the graphic details of the trauma. What we are trying to find by revisiting the trauma story is finding how people survive that trauma, what happened to them, what's their story, what's their resilience, how did they grow out of the trauma, what's the wisdom that they learned from their traumatic experience. Because believe it or not, most people become stronger and more resilient and more resourceful after their traumatic experience. They maybe have better boundaries now. They are better able to express their emotions. They have regained their voice. They have rewritten their own story in a way that makes meaning to them. So yes, I agree with you. I mean, some people they want to go and revisit every repressed memory for the children. We try to shy away from that. We revisit the trauma story in order to find the positive, not necessarily only the negative.
Hmm. So what options are available for to reverse this process of trauma? What are the are there any medications, or are there any therapies that we can do?
Yeah, I mean, this is a very extensive field, and it's wonderful field. I think it's the most beautiful field of medicine. Maybe it's my own bias, but I have seen how children and how families and how communities recover after trauma when we give them the tools, when we teach them new skills, when we give them safe spaces so they can start to, have the permission to express their own feelings and just maybe recognize that they are not going insane because they have these feelings. So medications, believe it or not, are very used very rarely in the field of trauma. Maybe somebody needs a sleep aid. Maybe somebody has severe anxiety. We can control some of their anxiety or their insomnia. Some people with severe depression might benefit from an antidepressant, but most of the time there are therapeutic interventions. There are many therapeutic interventions. Maybe the most common ones are cognitive behavioral therapy, CBT, others like DBT, dialectical behavior therapy. There is EMDR when we use the eye movement. There is something called narrative exposure therapy. So we give people permission to narrate their trauma and expose them to similar situation within the safety of the therapy space. So there are many ways that we do this with the children. Most of the time we use the family and we use the community, and it takes a village to heal a child. So many of the children actually they don't have the words to express their trauma, so they find healing through play and art therapy. That's something I'm very big fan of, and I have seen beautiful examples when I visited refugee camps and war zones, and I conducted play and art therapy with children.
Mhm. Wonderful. Having said so, there are different types of trauma, and as you said, there are physical traumas and there are invisible wounds as well. So, how when the wound is not visible, how can one actually identify that I'm having, or I'm having the triggers, or how can one identify when the wounds are invisible?
Yeah, I mean, any sudden change in behavior, changes in reaction to a situation that happens yesterday, and yesterday I did not show the same reaction that I'm showing today. That means maybe today I'm missing one of my basic needs. Maybe there is something that I have not talked about that's causing me more irritability, more anger, more interpersonal struggle with a loved one or a colleague or community member. So we need to recognize that within ourselves, have the humility to actually listen to our inner voice. But because the culture has taught us that feelings are scary, feelings are um, indication of weakness, many times we need a support system. I need a lifeline. I need to lean on someone who will say, Omar, today I did not appreciate your attitude or your mood or your irritability. I wonder if we can talk about it. And I say, maybe I have not slept well. Maybe I'm missing my cup of coffee. Maybe I'm having a struggle with my wife or my children. So most of the time, all of these conflicts, if we just sit down with someone and ask them what happened to you or what's your story, we will find that we can avoid lots of the conflict. We can avoid lots of punishment and negative discipline that we give to our children. If we just spend time in rather than time out, either with children or with adults, we can do lots of good.
Mhm. And having said so, if a trauma is unidentified in a mother, so that mother wound can be carried in the children as well. Oh,
Yeah,
how can
absolutely.
this be? How can this be reversed, or how can this be? Because obviously, if a mother is not healed, that would her reactions and her behaviors would carry forward in the children in a way when she reacts abnormally or overly to a situation which does not require that much reaction. The children, their self esteem or their that would be affected in a way. So, what advice do you suggest in that situation?
Yeah, I have lots of advice when it comes to the issue of the mothers, because I believe mom is the foundation of the household. If I have a healthy mom, that means the whole home will be a safe and healthy home. But that needs participation from the father as well. So we need the husbands to support their wives. That's something missing in many cultures. Many times the mom is doing everything for the children on her own, and then the father will say, because I'm spending long hours outside the house, I'm trying to provide materialistically for my loved ones, and we tell them, but your children have emotional needs, not only materialistic needs. So in a way, they are losing the American dream, chasing the American dream. They are running behind all of these wonderful goals to provide for their families. But many children, they tell us, I don't need my dad to bring me toys or gifts. I need them to spend quality time with me. So I have noticed when we sit down with the fathers and try to make them part of the solution, because most of the women they are very open to discuss psychosocial issues. Fathers they find that to be a taboo issue. Many times when I run workshops and seminars, 90% of the audience are women. When I go to work with the refugees, and I find that the non-government organizations are mainly run by women. So it's very important to have the support of the men, but at the same time, we give the tools for the mom. So self-care is not a luxury in her case. It's very important that she have a sleep hygiene that's healthy, that healthy diet, lots of water and hydration, a little bit of physical exercise, and also having a very strong psychosocial support network. So people that she can sit down and talk to, people who can check on the mom, because exactly like what you say, if a mother is missing her basic needs, maybe she will vent her needs through anger towards the children, and that can keep the cycle going. That's why Untangled is something that I'm very passionate about. That's why during the quarantine, I have three daughters, and we created
Yes.
the daughter father bonding YouTube channel. So, teaching fathers how to bond with their children, especially their daughters, especially teenage children.
Wonderful. As you mentioned about men, about fathers, men generally in our culture, they are not expressive and they are not comfortable talking about their emotions. So, what advice would you give to men how to handle uncomfortable emotions or sit with their feelings? Because it's pretty uncommon for a man to cry or to come up with issues because that's not considered manly enough.
Yeah, many cultures they say, big boys don't cry, and all of these negative messages that we have received, all of us, we have received. Coming from an Islamic faith, though, I'm writing a book right now called The Trauma Story of the Beloved, which is how the Prophet of Islam, Muhammad, peace be upon him, he had many traumatic experiences that happened to him. He lost his mom, his dad, his grandfather, his uncle, his wives, 6 out of 7 children. He was forced to become a refugee and leave his home city. But at the same time, he was a wounded healer. He was very expressive in his emotions. So people saw him publicly crying. They saw his pain and sorrow. They saw his joy. He shed tears of mercy, and he said, people who don't show mercy, they're not going to receive mercy. And he gave permission to people to show safety towards the children. Children came and climbed on his shoulders, and that was actually the title of my very first book, On the Shoulders of the Prophet. Children around him felt very safe. They came actually and they climbed on his shoulder. And this is very, very important for children to grow and become safe and sane and have healthy personality. They need to believe that the world is a safe place and adults can be trusted with their needs. So many times the trauma that happens to children because the world is no longer safe, like the pandemic or wars or abuse, and also because adults sometimes take advantage of children and subject them to abuse and violence, and that's very, very unfortunate. It can shake the foundation of the children, it can shatter their core beliefs. That is healable if we find another caregiver that's willing to invest in the children. And sometimes it's not only a family member, it can be a teacher, it can be a community member, it can be a religious leader. So as long as we have um, a safe network around the trauma survivor, there is always hope.
Mhm. What do you mean by safe network? Because can we avoid trauma triggers, or are trauma triggers harmful, or can one be desensitized by triggers? Are these possible? How to have that safe environment?
Yeah, I mean, we need really to be careful. Of course, we don't shield our children from every exposure because it's very important for us to expose them to the real world. In the real world, not all their needs will be immediately, met. And many times they have to work hard to receive rewards. Many times they have to have responsibilities. So I have noticed that some parents are going to the other extreme. They're trying to become everything for their children. And that can actually take away from their children because that child needs to be exposed to some challenges that they can overcome. Children have to make decisions and face the consequences for these decisions. So yes, we need to protect our children from big traumas, like and trauma that can be avoided, like wars and explosions and armed conflict. At the same time, we cannot really right now prevent them from being exposed to trauma like the pandemic or the online, education and all of the things that come from exposure to long hours on the screen, and the conflict that can happen in the household because we are not having many avenues to do things as a family, or we don't have enough time for self-care as an individual. So finding the balance between spending time for a quality time as an individual, finding time to spend as a family, very, very important. Trying to completely shut our children from any trigger, I think will backfire. It's very, very
Mm-hmm.
important that we give them the tools so they can um, build some resilience and some self-esteem.
Mm-hmm. Mm-hmm. And resilience goes a long way.
Oh, absolutely. Resilience is not only the ability to bounce back from a traumatic experience, it's actually that you become stronger because of what happened to you. So, for example, if
Mm-hmm.
there is if you bring a container of boiling water, I can throw some eggs in the water and they will harden. Yeah, I can throw some maybe noodles and they will soften, and they can throw
Mm-hmm.
some coffee beans and they will change the whole environment. They bring a flavor, they bring color, they bring smell. So all of these are ways to cope with the same trauma, which is boiling water, but everybody coped in their own way. And we don't judge the egg or the coffee or the noodle. All of them are resilient in their own way. So I never like
Mm-hmm.
minimize the trauma story I hear from someone because my trauma is more significant than theirs. Everybody's trauma is significant to them, and I need to respect that. They need to work with them and teach them that they have survived the worst. So right now we need to reteach them how they survive that. We rediscover together the inner skills, the resources, and if they need the external resources, there is no shame of connected them with a professional.
Thank you. Thank you, Dr. Omar, for the valuable information. From where we can get your books? Are they available online?
Oh, thank you. So Untangled, of course, has been available since 2019. I have two other books before Untangled, which one is called the effect of violence on children, and the other one is that on the shoulders of the prophet, which has to do with the example of the prophet and how he was safe around the children. But the book that I'm writing right now, which is called The Wounded Healer, will be released on March 15, 2022. And then the trauma story of the beloved, the trauma story of Prophet Muhammad, will be released most likely the end of 2022. And most likely they will be on Amazon and other websites.
Mm-hmm. Okay, great. Thank you. Thank you for your time, Dr. Omar. It was a pleasure talking to you. I'm
Thank
sure
you.
the audience would have benefited from this knowledge. Have a great time. Uh, Thank you. Signing off, Omar Nasim.
Thank you very much. It was a really pleasure and honor.
Uh,
Thank
Pleasure
you.
is all mine.